right, Hartford Hospital has launched an effort to educate people about CPR. Dr. Thompson, co-physician-in-chief at the Heart and Vascular Institute, is here to talk about the hospital's Be a Lifesaver campaign. Good morning to you. We've been talking about all kinds of things this morning. I could listen to you forever, but let's talk about something that many of us can learn, and we can actually, save someone's life. We never really know when this is needed, right?
So, Shannon, here's what happens. The heart normally beats, as we know, gush, gush, gush to propel blood around the body. But there's an occurrence that can happen called ventricular fibrillation, in which the heart just quivers, so it doesn't move blood around. And that's not that uncommon. It happens with heart attacks. It happens with other instances. So what we're trying to do is a public health campaign to get people to do hands-only CPR, and that's simply pumping on the chest. You call 911 first, of course, because you want to get help. But as soon as you can, you start pumping on the chest. Now, why do you do that? Every minute that goes by that a person's heart is not circulating blood gives them a 10% increased chance of dying or being left with severe neurological deficits. So 10 minutes is a long time. That's like almost 100% chance that that person's not going to do well.
Right.
So it's so important for people to know how to do this and to start it.
And do it right. So again, how are you getting people involved with this? And it's open to anyone that wants to learn?
Yeah, so there's a website you can go to and look it up, and at Hartford Hospital website. What we want people to do is call 911 and just start pumping away. If the patient's unresponsive, you don't have to bother about checking a pulse. And one of the things that's new about this, and it's done through the Heart Association, is not breathing the patient. And why is it, or breathing the person? That's because a lot of people would have done CPR if they didn't have to breathe the person, because they're afraid of getting a disease or something. So the pumping on the chest moves enough air to keep air circulating through the lungs and through the body. So simply pumping away. And what do you pump at? How fast do you pump at? Well, you want to have a song that you kind of beat to. And the one I always use is Staying Alive by the Bee Gees.
Yes.
So that's my favorite song. And, I'm a guy from the 70s and all that sort of stuff, so I know the Bee Gees.
There you go, yeah. And I think, too, probably part of the training involves just the initial response, learning to just, sometimes when we see something like this, you can probably train those folks to, again, jump into action,
Do something.
Right.
The first thing, I said it, this is the third time I'm going to say it, is call 911 so that help is on the way. You can get the pros there to help you. But you're a pro at simply pumping on the chest.
Absolutely. And the hospital has a lot happening tonight in regards to heart health. Your night of black and red happening tonight. We going to be there?
Yes, well, I must be there. It's part of my job, I'm sure. But it's also fun. And so the black and red ball is something that's done every year. This will be the 27th time, and they have an entertainer. But it supports something at the hospital. Along with that, there's always a public benefit campaign of some sort. 2 years ago, it was not using a cell phone when you're driving, hands down. This year, it's kind of hands up or hands-on only CPR.
All right. Once again, where can folks go to learn more information about this training?
So the Heart Association is always a good site, and then also the Hartford Hospital website has a little link that can get you to hands-only CPR, and you can learn how to do it. You can pick a song, you can take a quiz, and you have fun with it.
There you go. Dr. Thompson, thank you so much. And, you never know when you might need it.
You don't know when you need it.
That's right. All right. And, of course, the event happening tonight here in NBC Connecticut, you can watch more of that. And, Darren, I want to get you a check, have you check our forecast, because a lot of those folks probably maybe wearing some dresses.